Before watching the video, do not forget to subscribe to our channel by clicking the subscribe button below and clicking the bell icon to be notified whenever we upload new video. In this video, we'll discuss the causes and types of bruises, and why it is important to observe them. Blue bruises, often referred to as contusions, are a kind of skin injury that develops when capillaries, which are tiny blood vessels, break and bleed blood into the nearby tissues. As a consequence, the skin becomes discolored, usually beginning as a deep blue or purple color and gradually fading to green and yellow as the bruise heals. Bruises come in a variety of forms. When you get bruises, it is important to examine what type of bruise you have so that if you need to speak with a healthcare provider to deal with any serious condition. Types of bruises. Hematoma. A hematoma is an accumulation of blood that develops outside of blood vessels, frequently as a result of a serious injury. Hematomas can be uncomfortable and may need medical care to avoid problems. Ecchymosis. An ecchymosis is a bruise with a diameter greater than 1 centimeter. These bruises may be more painful and take longer to heal than smaller bruises and can develop as a result of trauma or injury. Petechiae. Petechiae are tiny, pinpoint-sized bruises that develop as a result of the bursting of blood vessels under the skin. They might indicate an underlying medical condition like an infection or blood disorder. Purpura. A purple or red rash on the skin results from blood vessels leaking into the surrounding tissues, which is a sort of bruise. Numerous things, such as drugs, infections, and autoimmune diseases, can lead to purpura. Subcutaneous. Blood pools beneath the skin without penetrating to the surface, resulting in subcutaneous bruises. In comparison to surface bruises, these bruises may feel painful to the touch and heal more slowly. Why we shouldn't ignore bruises. Do not ignore these bruises, and it's crucial to keep an eye out because in some cases, a blue bruise might be an indication of a more serious underlying illness, like a bleeding or blood clotting disorder. In addition, if a blue bruise is really large, painful, or accompanied by other symptoms like fever or difficulty moving, it could indicate a more serious injury like a fracture or internal bleeding. The body requires vitamin C, commonly known as ascorbic acid, for a variety of processes, including collagen synthesis, immune system activity, and wound healing. The protein collagen gives the skin, blood vessels, and other tissues their shape and strength. Vitamin C deficiency can affect the formation of collagen, which can weaken blood vessels and make them more vulnerable to injury and bleeding. Deficiency of vitamin C causes bruises on body, and sometimes situation becomes worse. A crucial component of blood clotting and bruises is the fat-soluble vitamin K. In reaction to injury or damage, it is required to activate particular proteins that aid in blood clotting. Without enough vitamin K, it's possible that the blood won't clot properly, increasing the risk of bleeding and bruising. Serious bleeding diseases like hemophilia are also more likely to develop as a result of bruising. How to treat bruises. Here is the home remedy for bruises. 1. To lessen swelling, apply an ice pack. To prevent putting the pack directly on your wounded skin, wrap it with cloth. For 15 minutes, leave the ice on your bruise. If necessary, repeat this every hour. Rest the injured area. If possible, elevate the area of bruising above your heart to prevent blood from seeping into the damaged tissue. 2. Use an over-the-counter painkiller to ease the discomfort, such as acetaminophen, Tylenol. Ibuprofen and aspirin should be avoided as they may cause more bleeding. 3. To prevent bruising on your arms and legs, wear long-sleeved clothing and pants. Bruises may indicate a health problem that is underlying. It's crucial to seek medical advice if you frequently or unexplainably bruise, or if you experience other unsettling symptoms in addition to a bruise, in order to identify the cause and the best course of action. Due to a lack of blood clotting factors, people with certain bleeding disorders, such as hemophilia, may bruise more than usual. Similar to this, people who have certain cancers or liver conditions may also bruise more easily due to alterations in blood coagulation systems. If you enjoyed the video, please give it a thumbs up and share it with your friends. We would love to hear your thoughts, so please leave your comments in the section below. If you're new to our channel, consider subscribing and turning on the notification bell to receive updates on our latest videos. Thank you for watching.